Let's bring in physician at Stanford Children's Health, ABC News medical contributor, Dr. Alok Patel, for more on this. Dr. Patel, hi there. So,
good morning, Diane.
This is an odd time to be talking about looking out for red, itchy eyes. How do people tell the difference between if they have this new COVID subvariant or if they have allergies, because it is allergy season?
Well, simple answer, Diane, is you take a COVID test. It's like over the past 3 years, there's been a couple symptoms that put allergies in their own category, and red itchy eyes was one of them. Well, now no longer, with XBB.1.6 causing anecdotal reports of people getting conjunctivitis or those red eyes. But remember, all these variants are under the Omicron family tree, so testing still works, as does Paxlovid, as does all the other treatments that we currently have.
Now, overall COVID numbers are down, and this variant doesn't appear to cause more serious illness than others. So how concerned should we be about this?
The concern should be more about just kind of monitoring what is happening. Right now, there is no reason to panic, as Ariel reported. There is no increased reports of hospitalizations, ICU admissions, generally disease severity, but the growth advantage, or the fact that this variant may be more immune evasive than previous Omicron strains, just have the World Health Organization and the CDC keeping an eye out for what may be happening in these countries where cases are rising. So we may be seeing an increase in case reports, and that is just something that we need to keep an eye on, and what we're going to potentially be looking at when it's time to create a new bivalent vaccine this upcoming fall.
There's also been some confusion over the latest booster guidance. So how do you know when it's time to get or re-up your COVID vaccine?
Well, in terms of what's going to happen in the future, we got to wait and see. But for now, what people generally should know is that we have moved to a new model where if you are currently unvaccinated, what you need to get now is a single bivalent vaccine. So that is the shot that has the original the original SARS-CoV-2 strain, plus this new updated vaccine targeted towards Omicron. And hopefully this new model is more streamlined and gets more people going and getting their shots if they haven't yet done so. And what we need to remember that the FDA did approve a second booster shot for those who are above 65 or who are immunocompromised.
So is the idea that any new variant that is still under that Omicron family, as you describe it, will still respond to this vaccine?
Well, fingers crossed. And for now, that is what the hope is. But this is kind of a big lesson for epidemiology right now, in saying that as long as we let viruses replicate, they may continue to mutate, which is why they have to be monitored, and why on about April 17th, the World Health Organization changed the designation to variant of interest, because these changes in XBB.1.6 that may allow it to grow faster. But that's 100% what it's all about, is just keeping an eye on these variants, not saying there's a cause for panic, but kind of giving people guidance of what they should expect.
All right, Dr. Alok Patel, always great to have you. Thank you.
Thank you.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.